Is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson, and it's my pleasure tonight to have Mr. Sonny Watson with us. Welcome, Mr. Watson. Well, now, you are the poobah, are you not, of the Houston County Commission and the Houston County Healthcare System? Is that right?
Well, I wouldn't exactly call it that. Of course, I'm called worse than that sometimes, but it's the chairman of the Houston Hospital Health Systems.
Well, and that's kind of a big deal, isn't it? You have, how many employees are in your?
Got about 2,200 full-time, part-time employees.
And you have 2 hospitals in your apparatus, is that right?
Yes, one in Warner Robins is 239 beds, and the one in Perry is 50, but we only have 40 of them. 10 of those beds are used by hospice.
And so your I guess, position is, it's been, so it's a quite lofty one, but you've actually been associated with the hospital for many years, is that right? How long did, what happened with that?
Well, indirectly, of course, I was employed by Houston County as a county clerk back in the 50s, and I was the clerk when the hospital was built here, and it opened in 1960. I was appointed on the Houston County Hospital Authority and served 3 years on the Houston County Hospital Authority, and then we converted it to a nonprofit corporation, a 501c3, about 2 years ago. We've been operating under that for the last 2 years.
And that's, so you've seen the evolution of the governance of the authority, and what do you think about the present arrangement? Do you think that's a pretty good one?
Well, I think it's really a lifesaver financially for us, because if we depend on just the hospital revenue, now with the indigent care, Medicaid, Medicare, and the insurance companies constantly reducing payments to us, we'd have a hard time surviving, I think. But by being able to have other profit items or profit corporations, it allows us to have other streams of revenue coming in.
Well, so was that a difficult transition? I mean, obviously the governance is going through lots of ups and downs, and how did you do that? Was there an election? I mean, how were you able to make the transition to your present arrangement?
Well, we spent, our board first, the hospital authority, met, and they voted to do this. Then the CEO and I spent probably 3 days or more meeting one-on-one with the county commissioners individually, explaining to them what was involved so that they would know exactly what was happening. And we asked for their blessing, and we seemed to receive their blessing. And then the hospital was technically leased from the Houston County Hospital Authority for 40 years.
Yes. And
now we're a nonprofit organization, and the members of the board now are not appointed by the county commissioners.
Yes, and so really, I think anyone involved in the healthcare field can see the enormous sense of transition and change underway, and financial conditions. There could be some rough water out there. So do you think you're in the position, at least from a structural point of view, to manage the waves that might come along?
Well, I don't know, because we don't know how big the storm's going to be.
Yes, yes.
We're all looking forward to 2014 as to what's going to happen with the Obamacare.
Yes.
What's going to happen with insurance companies, what's going to happen with health care. It's just all so unknown.
Yes.
Till we're trying to make every way we can prepare to meet that challenge.
Yes. And right now, maybe you could explain the word that maybe some of our viewers have heard this, cost shifting. So if you have full insurance and you come to any kind of healthcare facility, there's something called cost shifting going on. What exactly is that?
Well, I guess what we're talking about is, and we'll start off with, just for an example, we have one insurance company that is TRICARE.
Yes.
In which we take all TRICARE patients with no question, and they reimburse, insurance company reimburses the hospital about 33% of the bill.
Yes.
So you have 67% of the bill
Yes.
that you don't get reimbursed for. Medicaid probably does, and Medicare, 45 insurance companies. The most, I think, any of them is about 48%.
Yes.
So,
Yes.
and then the hospital has to, we cannot bill for anything other than the deductible that's on the policy.
So one of the things that happens is that if you're in a situation where you have a lot of people that you mentioned TRICARE, or shall we say Medicaid, that makes the financial situation for any hospital difficult, does it?
It does, and I think one thing that we've been reading a lot about the medical center in Macon and et cetera is indigent care.
Yes.
Indigent care and bad debt at our hospital.
Yes.
This year will probably be in excess of 62 million.
Wow, that's a huge number. So
and we do not receive one dime from the county commissioners of the county for indigent care or our ambulance service.
yes. And so are you able to make your numbers, or what's the financial situation of the hospital these days? Are you doing okay?
Yes. As you know, equipment is very expensive now.
Yes, yes.
You can buy a CAT scan machine now with I guess the terminology is 64 slides, which
Yes,
is
yes.
normal, and you're talking about $1.5 million.
Yes.
All equipment is so expensive, but we've been able to negotiate prices, and we have operated with a profit that we have to have.
Yes.
To keep up with the building and the depreciation and et cetera.
So that's a really important task, just to be able to do that. And in your new structure, you sort of mentioned that made it easier for you, the nonprofit status, and I think there's some things that you've done. I mean, different kinds of transactions to make those numbers that would not have been possible earlier. Is that right?
Well, that's right, because number one, but we don't take advantage of it, but number one, we were restricted to Houston County by being an authority.
Yes.
As a 501c3 nonprofit, we could technically go into Peach County.
Yes.
And put a facility, or Bibb, or
Yes.
Pulaski, or wherever, but we haven't discussed it at all. But
Yes.
that's one thing we can do. We can have for-profit corporations that own parts of businesses.
Yes.
We own a percentage of health care, Care South.
Yes, yes.
And we own a part of the cancer center.
Yes.
With the doctors there. So,
Yes.
And then we're always looking at other areas to expand into outside profit making for us.
So, really, your function is you have to be pretty nimble. I mean, it's not just being a bureaucrat. It's like being a businessman in a way, is it not? Understanding some of the pros and cons of investments, and it's really quite complicated, isn't it?
Hospital's big business.
Yes.
And it's not like any other business that
Yes.
that you could name.
Yes.
There's so many different things involved in it.
Yes.
And then what we have to look at more than anything is patient care.
Yes.
And patient service. That's what we're going to do.
Yes.
And we're going to continue to try to provide that in an excellent way.
And the numbers are going up a lot. Is that correct? I think you had
yes.
60. How many thousand people came to your emergency room?
In excess. This is in Warner Robins only. In excess of 62,000 last year.
Wow. And so
about 15,000 in Perry.
That's a big responsibility, just making sure those patients can be effectively dealt with. And well, I'll tell you what. Maybe you can just name some of the problems you have sitting in your position. Is that a good softball? Can you hit that one? I mean, what are some things that confront you in your task?
Well, we've talked about a lot of it, but
Yes.
I think on top of the list is expansion.
Yes.
We are starting within in the next 4 or 5 months, so we're going to do interns here.
Yes.
Doctors out of the medical school, they're DOs.
Yes.
And we've got a contract with them, and we received a state grant. And so we'll have about 12
Yes.
of those, which will help us working in the emergency room and running clinics and doing a lot of different things for us. Expansion, always.
Yes.
I know 2 weeks ago, I talked to the CEO. We had 14 people in the emergency room in beds, waiting on beds.
Yes.
Patients cannot receive the care, doctors cannot give the care
Yes.
to their patients in a bed in the emergency room.
Yes.
So we try to move them out as fast as we can, but we just got full. We were over 100% full for
And so
several days.
What happens? Do you go on diversion? I mean, what occurs when this sort of event happens? What do you do?
Well,
I mean,
we go on diversion. The first thing we try to do is send them to Perry
yes.
if we can, and then if Perry's full, then we divert them to Macon.
Yes. So that's that can be a quite complicated situation, can it not? Often, if you could be in the emergency room, and the system, it's sort of a system breakdown, isn't it? I mean,
Well, you know, everybody is always hesitant about calling for a diversion.
yes. Yes.
They want to be sure.
Yes.
And sometimes we might wait a little too long
Yes. Yes.
about doing it. And then if you call it early
Yes.
and start sending patients and you got empty beds,
Yes.
then that doesn't sit good. So you got to balance that out.
Yes.
Buying new equipment, it was
Yes.
mentioned earlier, expansion, indigent care, Medicaid, Medicare, all of those things.
Now-
and then investments
Yes,
of what
yes.
funds we have.
Yes. So that's a complicated thing, deciding what to invest in, what piece of equipment to get or not get, and how do you go about that? I mean, there must be a big demand constantly for cutting edge technology, and
Yeah.
how do you decide what's good and bad for your hospitals?
Well, it goes through lots of people before
Yes.
it gets to us. It goes through the head of that department and the committee on the medical executive committee that deals with that. If it's operating stuff, it's the operating
Yes.
committee and
Yes.
the doctors involved, and they make their case. And then after
Yes.
the case is made, it goes to the Houston Health System, Houston
Yes.
Hospitals.
Yes. Yes.
And then that board takes it up and approves it or disapproves it, and then it comes to us.
Yes.
Excuse me. If it's over $50,000, it has to come to us for final approval.
Yes. Yes.
So it goes through lots of different people before it gets approved.
Now, how many members on your board presently?
7.
7. And how do they get there? Are they appointed, elected? What happens? What's the succession arrangement? How do you do that?
Well, in the beginning, the Houston County Hospital Authority appointed the board.
Yes.
And then after the board was appointed, then the systems board appoints the hospital board.
Yes, yes.
And 2 members of the systems board
Yes.
serves on the hospital's board.
Yes.
And we technically have 4-year terms.
Yes.
But we can be reappointed
Yes.
by the board.
Yes.
So the board makes its own appointments to the board.
And who do you try and get on the board in the appointments? Would you try and get people that's skilled to be able to navigate the hospital, get a different opinion? How
Let
do you
me
do
give
that?
you an example. We've had one member of our board is a CPA.
Yes.
He was comptroller at Macon State for years.
Yes.
And he's chairman of our finance committee.
Yes.
And he's real involved with us.
Yes.
We do a lot of cooperation with the Middle Georgia Technical College.
Yes. Yes.
They do training for us for LPNs,
Yes, yes.
scrub techs,
Yes.
equipment repair, and we appointed the president
Yes.
of Middle Georgia Tech so he can see the need and then have the classes to fill those
Yes.
needs.
Yes. Yes.
And so we try to have one of them's attorney
Yes.
is on the board.
Well, that's important. No, I think I'm happy to hear you have at least one lawyer.
And
That's,
one is a physician.
that's good too.
So we've got a pretty good mix and a lot of different
Yes,
opinions.
yes. And the people that do this, it's an enormous amount of time, and it's not really a compensatable kind of thing. It's just a community service.
Well, the compensation we receive, we get 1 free meal a month when we meet.
Is that right? Is it pretty good food or?
Yeah.
Good.
Yeah.
Well, that's not,
food
that's
is
good. At
good,
least you get
so,
one good
yeah.
meal a month out of it.
But it's not any per diem or any pay at all.
So that's an enormous amount of effort, and you try and get people that are really committed to the healthcare situation in this part of the world. And
well, when you're committed to healthcare, you're also committed to Houston County.
yes.
And that's one thing that we're interested in, is serving the
Yes.
people of Houston County and committed
Yes.
to provide excellent medical care here.
And the population of the county is growing. I mean, it's one of the fastest growing counties in the state. Is that right? There's a lot of people.
Yes, we've grown probably close to 100,000. We're almost as big or as large as Bibb County now.
And that's a rather interesting relationship, is there not, between the two counties and the medical needs of each county? Do you operate in sync pretty much with the hospitals in Bibb County, or how does that work?
Yeah, we do. We work closely with the Med Center.
Yes.
We use them. Of course, they do most of our heart patients that are sent there for heart surgery.
Yes.
Trauma 1, I don't know
Yes.
where they particularly want all of those, but but we have to send Trauma 1 patients
Yes,
because we
yes,
can't
yes.
treat them here. We work well with Coliseum.
Yes. Yes.
We've had our CEO to meet with each one of them. We don't know when there might be an emergency,
Yes, yes.
crisis in Macon, they would need us,
Sure.
or crisis out here, we need them. We gave a lot of money, cash
Yes,
money,
yes.
to Sumter County and Americus when their hospital was destroyed.
Yes.
We sent ambulances down there, some of our ambulances,
yes.
and did not charge them for it.
Yes.
So we try to help them.
You know, one thing that an external observer could say is this is sort of the American way, isn't it? I mean, there are people, local people, they're taking care of their health needs. They're trying to do the best job. They understand the situation in the community. And it's not sort of a top-down kind of arrangement in healthcare. There are a lot of advantages to the situation that exists now. I mean, you mentioned the changes that might be coming. I mean, are you preparing for that? You're just waiting to see what occurs? No one knows, do they, as to what may happen?
Well, you know, you made the statement that you've got healthcare people doing the healthcare jobs and they're interested in the community. And I think if the government would stay out of our business a little bit,
Yes.
That we could provide better health care and hopefully at a more economical price. So,
Yes.
But we're constantly worrying about what we're going to do
Yes.
for electronic medical records. It's
Yes.
required by this bill.
Yes. Yes.
They will give you money for it.
Yes.
And if you don't do it, you get penalized $50,000 a year.
Yes. Well, do you get a chance? I mean, a lot of regulations, and some of them are good. I think some of the regulations are
yeah, I
good that
do.
are out there. But the ones
Yeah.
that are bad, do you get a chance to complain? I mean, what happens if is it possible to, it's rather difficult, I would think, to say this doesn't sound reasonable. You just have to accept these. I think the Russian word is ukasi, which is that's what the czar would promulgate regulations. Sometimes they're called ukasi. But these regulations, can you complain about them, or just have to accept them, or what happens?
Have to accept them.
Yes, even though they're sometimes unreasonable.
They are.
Yes.
They are, and we feel like they are, but that's what we do.
Yes.
I know that Medicare and Medicaid both now, if you go into the hospital, and you being a physician,
Yes,
of course,
sure.
I'm repeating a lot
Well,
that you already
no,
know.
I think the viewers would like to hear your
But
opinions.
if you go
Yes.
into the hospital and the doctor does not list on your diagnosis when
Yes,
you go in the
yes,
hospital,
yes.
and you acquire something else there,
Yes.
let's say that you get pneumonia while
Yes,
you're there,
right.
Medicaid, Medicare doesn't pay for it.
Yes,
Hospital
yes,
has to
yes,
eat that.
yes.
If it happened that you had diabetes and the doctor did not put it on there,
Yes, yes.
then we wouldn't get paid for treating diabetes.
Yes, yes.
And neither would the physician.
Right.
So it's a both of them. So the physicians are real careful
Yes.
now to be sure they put what's on there.
And the amount of bureaucratic control that's exercised, that's a tremendous amount of resources that go into the paperwork and making sure that all the nuances of the billing apparatus are put together the way they want. It's
When
a lot
you're
of
talking
work.
about Medicare, Medicaid codes, you probably got 30 to 50,000 different codes to put
Yes.
in.
Yes.
Most physician offices have staffs that
Yes,
do
yes,
nothing but
yes.
coding for Medicare and Medicare.
Yes.
And it's a big job. And if you code it wrong,
Yes. It's
you know,
a big problem.
It's a lot of difference in money in one digit number
Yes.
that you might code wrong.
Yes. And so one of the things that happens just with hospital expenses and things going on are unfunded mandates. Sometimes the government requires certain things and there's no way they're not going to pay you for it. I mean, there are different things they may say, we want this or we want this, and you have to take the expense for that. I mean,
Well, another expense that we've got now is what they call the provider tax
yes.
that the state enacted last year. And it cost us about $2.8 million. It's 1.45%. They call it provider tax. We call it a bed tax.
Yes.
And then we get reimbursed some from Medicaid and Medicare reimburses that. But the end cost to us on it this year will be about $900,000.
And so that's a very burdensome kind of number. And if your hospital seems to be doing pretty well, but if you're in a more rural hospital, possibly with a patient, it'd be very difficult.
Well, but the higher Medicaid and Medicare
yes.
that you have,
Yes.
and the higher charity, like Grady,
Yes.
Grady will get more out of the fund than they put in it.
Yes. So you're actually transferring your resources to other hospitals around the state that have financial issues here. And then that discourages you from maybe having access to maybe more cutting edge technology. Just the numbers have an impact, is that right? You have to have a prosperous hospital to get cutting edge technology.
You cannot operate without the money.
Yes.
And we spend a lot of time. Our board, the Health Systems Board, meets every other month.
Yes.
The Finance Committee meets every month.
Yes.
So we look at it every month. We get a financial report on our investments each month to see, and you know, as everybody, we took a big hit
Yes.
on our investments.
So how if I could ask this, it turns out that hospitals such as yours, they have money in different kinds of investments, and that money, is that for hospital pensions, or what is that?
Two different funds.
Yes.
We've got one fund that we have that we put the profits that the hospital might make in, and then we can take it out of that fund, but we keep it invested to buy equipment and et cetera. And then we've got another fund that has the pension fund, and we're about, you probably hear all the time about all these corporations that are 10% funded and 90% underfunded. We're probably about 85% funded to 90% of our pension.
Well, that's pretty good. And so one of the things that might not be commonly understood is the financial welfare of hospitals such as yours. You have a connection with the stock market. So if the stock market, a big connection. And so the wisdom that by which you invest these funds or look after these funds turns out to be a big deal. Is that correct?
Right. I mean, it is, you know, that's figured in our budget.
Yes.
And of course, it was figured in our budget when the stock market dropped.
Yes.
And our stock went down a lot.
Yes.
But it's almost back to where it was.
Yes.
So we're thankful for that.
Wow, good for you. And so, how do you manage that? Do you have some professional guidance about it?
We put out requests for proposals. In fact, we got it out right now.
Yes.
But we have a professional investment firms that handle it, and they come down and make recommendations to us about moving funds from here to there.
Yes.
And the Finance Committee has to approve it.
You know, I think what we're getting here is just a sense of the complexity of a hospital. Just all of the enormous things going on with those 2,200 employees, the things that are happening. It's extremely complicated, isn't it? And so if regulations are just artificially fostered, they can do enormous harm unless they're very careful. They carefully consider the local conditions and local nuances of what happens.
Well, of course, a lot of that consideration is not given sometimes when you're passing legislation in Washington.
Yes, yes.
It makes a lot of difference.
Yes.
Our state legislature has been very responsive to us.
Yes.
And has worked with us a lot. We've got some great representatives and senators that
Yes.
has been with us on everything we've ever asked them for.
Yes, and there are a number, I can think of a number of politicians that are up in Atlanta that fly the Houston County flag, and that's and they do a good job for
They
this
do,
part of the world.
they
And they're
do.
nice people, and good for that relationship.
And
nice
we've
people.
been fortunate in the last couple of years that we've had some now in leadership positions that can only help us more when they get there. So,
Well, I hope that continues. I hope that continues. Well, now just one little comment about the growth. As I drove in, I came down the Watson Boulevard here. Now, is that a relative of yours?
my grandfather.
Your grandfather, and you were mentioning that you were born here in 1943.
No, I was born in 37.
37, 1937.
Warner Robins was born in 43.
Okay, 43. All right. Well, they're almost contemporaneous. And you were there were almost no people here. Is that
When
right?
I was born, in the general area, what is now Warner Robins, there were 52 people.
Wow. And so you mentioned you'd moved 4 times, and I guess one time to California, one time to Paris. No?
I moved 4 times, and the furthest I've moved any of those times has been 2 miles.
Wow. And so you've seen enormous changes, just constant changes going on. And how do you foresee the future? You have any comments about how things are going?
Well,
here?
we've been real fortunate in Warner Robins in Houston County. You know, you hear the state talking about there's 2 Georgias.
Yes.
There's Atlanta and then the rest of Georgia.
Yes.
I think that there's 3 Georgias.
Yes.
You got Atlanta, you got the central Georgia
Yes.
area, and then you got the rest of the state. I mean, we're enjoying a low unemployment based on the 10% that the entire state and the federal government at 9.8,
Yes.
and we're at 7.4 or something like that.
Yes.
So our employment is good. Of course, we got Robins Air Force Base is the biggest contributor to that, and and we have a lot of people insured.
Yes.
Here that you don't have in a lot of areas, like retired civilians from the base.
Yes.
They have insurance. Retired military here.
Yes.
They have insurance.
Yes.
So we have a high percentage of insured people and a lower percentage of indigent care.
And that turns out to be a very important issue.
Absolutely.
And so this makes it a little bit easier, if I can say this, to attract physicians here. Is that
Yeah,
correct?
that's correct. The mix is a whole lot better here.
Just because of some of the financial issues, and equipment makes it easier to get equipment as well, because of the.
Well,
the payer mix.
some of the physicians might argue with you about
Okay, I
that
see,
at
I
Houston
see, I
Healthcare,
see.
but.
And you make use a little bit of telemedicine, is that right? Were you telling me that?
Yeah, we, I don't know whether anybody else has started it yet, but we have what's called an EICU. That's in the Electronic Intensive Care Unit.
Yes.
And every patient in there, if their doctor or physician approves it,
Yes.
they are monitored 24 hours a day, 7
Yes,
days a week
yes.
by a panel of physicians out of
Yes.
St. Louis.
Really?
We have the microphones and the TVs so that they can talk to the patient if they want to.
Yes.
And if the doctor approves it locally.
Yes.
They're monitored 24 hours a day, and before a doctor is called back in to see a patient in the night, then he can consult with a doctor in St. Louis who's monitoring that patient to help him know whether to come or not to come.
Wow. So that's
it's free. We don't
sounds-
charge the insurance, or we don't charge the patient.
Wow.
And it's $750 a patient.
Gee. Well, whose idea? Was that your idea?
No, I can't take credit for that, but I can take credit for the valet parking. We do have valet parking, and it's free.
Well, that makes me want to come down there, and maybe I'll have my foot fixed here. It really is, it sounds like you're doing a great job there, and it's been very nice to talk to you.
Well, I've enjoyed it. I certainly appreciate you giving us the opportunity to tell our story.
Well, I hope you keep up the good work, and we'll be looking forward to hearing other good developments in your hospital facility, and keep up the good work. And we'll maybe have you back again to tell us about
Well, we appreciate it. Thank you for the invitation, and maybe you can come visit us at Houston Healthcare
that would be great. So thank you so much for coming, and we'll sort of at this point, I think they're telling me it's time to sign off. So thank you so much.
Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.